Historically, as physicians, we as healthcare workers, we're not targets. We have immunity. We're a protected class in conflict zones. But in Gaza, it's the complete opposite. It seems that if you are a healthcare worker, you have a target on your back, and you're at higher risk for being harmed.
Since October 2023, the healthcare system in the Gaza Strip has been under relentless attack. Already fragile due to a 17-year Israeli blockade, the system has now been systematically dismantled and healthcare workers directly targeted by Israel.
I don't think any of the hospitals are functioning to full capacity at all. None of the hospitals in Gaza. The term partially functioning is very loosely, right? Because there's very few resources for physicians to actually use for medical care. Very basic supplies are lacking, medical equipment, simple things like antibiotics, medications that every hospital has. Those are lacking in Gaza. And then there's specialists that were specialists that were imprisoned or killed or evacuated. So many of the specialists are lacking as well.
Humanitarian organizations like Doctors Without Borders have been forced to abandon 17 health facilities. Between October 2023 and December 2024, MSF endured around 50 violent incidents, including airstrikes on hospitals and attacks on convoys.
Every single ambulance there has a gunshot or some kind of damage to the ambulance. And when you ask them what happened, they said, oh, we got shot by a drone. We got killed or a sniper. And so what it does is it prevents ambulances from actually going and getting patients to bring to the hospital because they're too scared. They're going to get killed.
For international healthcare workers, the challenges begin long before they enter Gaza. At the border crossings, they face restrictive policies, intense scrutiny and deliberate harassment. They often also face difficulty leaving the enclave, as Israel refuses to allow them through its crossings to return home.
You're heavily monitored and restricted. You have guns pointed at you from the Israeli military the entire time. And as a healthcare worker, as a physician, I'm not military trained. That is extremely scary for me to have a gun pointed at me. It suggests to me that this is a tactic that they're using to intimidate and to prevent physicians from coming in. When physicians know that there is a chance they will be blocked from exiting, they're not going to go. And it's just a way to make it more difficult for healthcare workers to provide the care.
The World Health Organization has recorded 617 attacks on Gaza's healthcare facilities since October 2023. More than 1,000 medical workers have been killed, and at least 250 have been detained by Israel, many of them taken to unknown locations. Human rights organizations have reported alarming cases of detained Palestinian healthcare workers being subjected to torture and ill treatment in Israeli custody. Despite these documented abuses and the international community calling for thorough investigations, to this day not a single person has been charged for any crime against hospitals in the enclave. In December, Israel raided Kamal Adwan Hospital, strip-searched and detained both patients and medical staff, including Hussam Abu Safir, the head of the hospital, then set fire to it. Dr. Mimi Sayed was in Gaza as a volunteer doctor at the time.
He was, while I was there, abducted. He was illegally arrested by Israeli military and undressed and put out in the cold with patients, still hooked up to IVs and the rest of the healthcare workers. And he's still detained. He's been denied access to his attorney or outside communication.
هناك عندما تحتاج إلى العلاج يتم تعذيبك عند الطبيب وعند الممرض. هذا لم يحدث في العالم كله، أن الممرض والطبيب يعاقب الأسير، هذا يضرب عرض الحائط كل المواثيق الدولية.
Israel claims it is detaining doctors because they're Hamas agents and they've allowed the movement's fighters to use the hospitals.
Never did I witness a combatant or anyone carrying a gun, a fighter, anybody that was in the hospital. I never treated them. I never saw them walking around. All I saw were children, women, and civilians. That's who we treated.
With the first phase of a ceasefire now in place and humanitarian aid being allowed into the Strip, there is a hope that the healthcare workers and vital medical equipment will be given access to Gaza in an effort to save the lives of Palestinians who have endured 15 months of bombing, sniper fire and starvation.